This is a preview of the lecture video available on www.sonoshare.in on the topic Fetal Posterior Cranial Fossa. Short clippings of the various parts of the lecture will follow. Cerebellum, posterior cranial fossa anteriorly and medially is formed by the dorsum sellae of the sphenoid bone. Anterior petrous temporal bone meets the squamous temporal. The transverse sinuses lead into the sigmoid or the S-shaped sinuses shown by the green arrows, posterior parts. The cavitation starts in the meninx primitive to form the subarachnoid space, which is shown by the blue arrows. That is the future Cisterna Magna. The caudal half of the area membranaceae, or the posterior part, simultaneously vermis is not covering or separating the fourth ventricle with the cisterna magna, is normal until 18 weeks because the vermis covers only after 18 weeks. So this is very important line. So that is the landmarks in the transcerebellar plane. So why posterolateral approach? Because if you take a lateral approach, you see that the beam is parallel to the occipital bone, so which is not seen well, and then and it is normal is 5 plus or minus 3 millimeters, and the upper limit is 10 millimeters. The cisterna magna gets obliterated after. Sometimes you can see you should be an ideal the thalamus, the brainstem, the vermis, and the posterior fontanelle. The posterior fossa structures are perpendicular. The primary fissure is consistently seen as open fourth ventricle or increased cisterna magna, posterior diameter. The nomograms are available incidence. The most common is megacisterna magna. To assess this, what we need is a midsagittal plane formed between the first and third lines is called the brainstem tentorium angle. So roughly more than 45 degrees. Here it is 72 Vermian hypoplasia, and the BV angle is increased. Magna is of normal size. So the transcerebellar axial scan shows the open fourth ventricle features. The vermis is normal and the BV angle is normal, but there is an enlarged cisterna magna hemisphere. So that is arachnoid cyst. Another case of an arachnoid cyst in the axial and coronal planes, showing the cyst and the pressure effect on where in the axial scan of the head in the posterior fossa you see a huge and in the frontal region, and that is due to the dilated straight contours within the dilated sinus. So this is a thrombosed cerebellar hemisphere, and little posterior coronal scan you see this. This is seen in the axial scan. You see the one of the cerebral scan. You see the foliae are seen to run across the midline, as shown in the image on the right side. You see the folia extending from side to side. It will show the normal cerebellum as if there is presence of vermis. Similarity of the posterior fossa seen on the transcerebellar two images, and if you see the enlarged fourth ventricle cisterna magna complex in the first trimester, we have to follow a neural tube defect, and that is the specimen. And another 40 in Vermian hypoplasia, less than 40, and Dandivock malformation. Having gone through the preview, if you wish to listen to the main lecture video, go to sonoshare.in.